Right ventricular infarction result from the occlusion of right coronary artery. This may represented as hemodynamic instability, especially when associated with inferior wall MI, so that the obstruction in the right coronary artery may result in right ventricular infarction and infarction at the inferior wall of the left ventricle. Phases of infarction using ECG. تحديد مراحل MI بناء على التغيرات التي تحدث على ال ECG تخطيط القلب. The first step, hyperacute T wave, which is tall T wave, peaked within the first 2 hours of infarction. بأول ساعتين من الأمعاء بكون عندنا tall T wave، وهذه الفترة عادة قليلة جدا، ساعتين، ما بالحق المريض يجي من بيته إلى المستشفى بتكون رايحة. And the T wave becomes inverted، تنقلب التي ويف بتصير لتحت، وهي T wave inversion حكينا دلالة على وجود اسكيميا. The second phase is fully evolved phase, the appearance of ST elevation and ST depression in the opposite lead, and the Q wave, which result or appear after hours to days. The ST elevation also indicates injury, ST depression indicate ischemic changes, Q wave indicate permanent necrotic tissues. The permanent stage is the last stage, which is the Q wave appearance. The types of infarction based on the ECG changes: the ST segment elevation, MI, characterized by the presence of ST elevation, Q wave, which is a permanent Q wave on the ECG. The second type is non-ST elevation, non-STEMI, characterized by no ST elevation, no Q wave, but the appearance of ST depression. ايضا الاس ديبريشن تظهر بالانستيبل انجينا، لكن الانستيبل انجينا بيكون نيجاتيف كارديك انزيم، اما النون ستيمي النون كيو ويف بيكون بوزيتيف كارديك انزيم. These are the differences between the STEMI and non-STEMI. الستيمي فيها ST elevation والنون ستيمي ما فيها ST elevation. الستيمي فيها Q wave والنون ستيمي فيها ما فيها Q wave. الستيمي تسمى ترانزميورال والنون ستيمي بنسميها سب اندوكارديال. بالستيمي large infarction وبالنون ستيمي small infarction. بالستيمي high cardiac enzyme elevation وبالنون ستيمي elevation of the cardiac enzyme but at the borderline. Assessment history, we're asking about chest pain, and previously we discussed the type of chest pain, which is like having a squeezing, chucking sensation, substernal chest pain radiated to neck, left arm, back, and jaw. The pain is prolonged, unrelieved by rest or nitroglycerin, and may we need here a strong analgesic like morphine. Nausea and vomiting, especially in inferior wall MI. Diaphoresis, dyspnea, weakness, fatigue, anxiety, restlessness, confusion, and shortness of breathing related to decreased perfusion to body organs and decreased oxygen supply. After stabilizing patient, detailed history could be taken from the patient. بعد ما يستقر وضع المريض ممكن ناخذ احنا الهيستوري بالتفصيل من المريض. Diagnostic tests: ECG. 70% of occlusion of coronary artery ought to demand exceed the supply so that this may result in ischemia. This ischemic changes, if it is prolonged and not corrected, this may lead to injury. This injury, if no adequate blood supply reaching the myocardium, this may result in infarction, so that ischemia, injury, infarction, both ischemia and injury are reversible, while infarction not reversible necrotic tissues. The ischemic tissues represented by T inversion, ST depression, injury represented by ST elevation, infarction represented by Q wave infarction. Assessment by ECG: the ischemia, as we said, T wave inversion, ST segment depression in the lead facing the infarction. خصائص التي ويف تكون symmetrical متشابهة, narrow pointed. The asymmetrical inversion of T wave does not indicate ischemia. The ST segment depression of 1 to 2 mm or more for duration of 0.08 second. Flat or depressed ST segment make sharp angle when joining T wave, not smoothly. هاي صفات ال ST segment. ST segment elevation 1 mm in limb lead, 2 mm in chest lead indicate an injury. The ST segment have downward concave or curved shape and merged unnotes with a T wave، يعني تندمج بطريقة غير ملاحظة أو ملحوظة مع T wave. Infarction. At the time of infarction there is T wave inversion or ST depression, there is ST elevation, there is a Q wave. In the early stage حكينا في hyper acute T wave. Next في ST elevation several hours, elevated in the lead facing the injury, and the opposite lead فيها ST segment depression. يعني إذا كانت الأم بالanterior lead إذا أنا بتوقع على الانterior lead في ST elevation لكن على الposterior lead في ST depression. هاي بنسميها reciprocal changes، هي ظهور ال ST depression in the lead opposite to the MI، في الليد المقابلات لل ST elevation، بالانterior في ST elevation بالposterior في ST depression. Last stage on the ECG is the presence of the Q wave, which is the pathologic Q wave in which the Q wave is 1/4 to 1/3 the height of R wave. انخفاض ال Q wave يصل إلى ربع إلى ثلث ارتفاع ال R wave، وهذه عادة تظهر بعد 24 إلى 48 ساعة and stay lifelong which is permanent، لأنه necrotic tissues حكينا في الأم آي ما بتروح ما بتختفي. In picture A, we clarify the hyperacute T wave. In picture B, the T wave inversion. In picture C, the ST elevation. In picture D, the ST depression.